We'll stay with this conversation on COVID-19, but remember that if you want to be a part of the PEF program, do go onto our socials. It will be tomorrow, and it will be a virtual event. We'll have more details on your screen shortly. Now, over 30,000 patients, mostly children, are on the waiting list for financial support to undergo life-saving surgeries. The patients have varied orthopedic and complex spine deformities which threaten their lives. Medical Director at the Focus of Orthopaedics Hospital, Dr. Irene Wolf, blames the swelling number to the COVID-19 pandemic, which has greatly impacted donations to the facility. MFA Etiama Eli has more. And so we'll take the time and the place.
Orthopaedics Hospital has seen an 87% reduction. The development has affected the country's premier and internationally acclaimed specialist health facility and its care for the vulnerable who have complex health problems. Managers at the facility blame the drop in donations on COVID-19 restrictions put in place to check the spread of the disease.
On our waiting lists, we have over 3,000 people who need help, which they cannot currently afford. Some have been on there for a long time, especially with the COVID last year, where there was a bit of a reduction in the donations that we get to take care of them. And so they are in a bit of trouble because with the deformities that they have, as time goes on and they are not helped out of them, they are not treated, the deformities get worse. And then when the heart and the lungs become involved, then the situation sometimes becomes irreversible. And so then they lose their chance of help. And that leads to unfortunate death.
Focus has largely relied on voluntary contributions from philanthropists, groups, organizations, institutions, and individuals to settle the medical bills of persons with complex spine and bone conditions. 90% of these cases are made up of children. Often, apart from money, donors walk in to present supplies, equipment, among others, for the treatment and upkeep of patients. With land borders and airports closed for the greater part of 2020, a number of such supports have reduced significantly, drawing back on the hospital's otherwise speedy treatment of patients.
Yes, they always come in a lot of tears. Patients crying, parents crying, and they have been waiting for a long time. And everybody is always waiting for their phone to ring to see if they will be the ones who will be called to come for the care. But depending on where you are on the waiting list and how complicated your problem is, some may have to come before others. So it's not an easy situation at all.
The call for support has become louder and more pressing than ever, attracting the attention of two patients who have successfully undergone their treatment following intervention by some organizations. 26-year-old Karen Nyakun said, but for her benefactors, she wouldn't have been able to realize her dream and gained self-confidence.
I'm more comfortable now. I can wear anything I want to wear. In the beginning, I wasn't able to wear any fitting dress. I was not comfortable at all.
Why?
In sitting, in public, even dressing nicely, no.
Was it to cover up? Was it for stigma? What exactly? Why couldn't you wear those kind of dresses?
Oh, it was to cover up. Initially, the children I handled, I had to carry some of them and then all that. But after the surgery, now I can do more than that.
32-year-old Dorcas Ampofo is now a mother, thanks to her benefactors too. She says the challenge of securing funds to see herself through the process was daunting.
I was shy to raise funds, to even come out to raise funds. I told my parents that I cannot do this because someone would think that you are a scammer or something. But my mom said, so So I decided to come out publicly to raise funds. Yeah.
Both patients are making a passionate appeal to the general public to come to the aid of the over 3,000 patients requiring support.
Anybody watching me, if you have any little support, you can just pass by Focus and come and support.
Okay.
Yeah.
Okay.
You shouldn't wait for someone to be on social media seeking funds before you contribute.
If anybody has anything to offer, yes, they can do that willingly.
Managers are assuring the public all COVID-19 protocols have been put in place to ensure safety for all visitors and patients at all times. Amafa Ewenam Atiamwa Eli for Joy News, Accra.